How does the FSA use it or lose it rule work? Have you ever wondered what happens to the money in your flexible spending account at the end of the year? The use it or lose it rule is a key aspect of how flexible spending accounts, or FSAs, operate. This rule states that employees must use all the funds in their FSA within the plan year. If they do not, any remaining balance is forfeited back to their employer. This means that if you have money left in your account when the year ends, you will lose it. However, there are options that employers can provide to help employees avoid losing their funds. One of these options is a grace period. This allows employees to continue using their FSA funds for up to 2.5 months after the plan year ends. For example, if your plan year ends on December 31st, you might have until March 15th of the following year to use any remaining funds. If you do not use the money by the end of this grace period, it will be lost. Another option is the carryover feature. Instead of a grace period, some employers allow employees to carry over a limited amount of unused funds into the next plan year. The Internal Revenue Service, or IRS, sets a cap on how much can be carried over. Recently, this amount has been around $660, but it can change each year. If your employer offers this option, you can use the carried over funds in the new plan year without losing them right away. However, it is important to note that an employer cannot offer both the grace period and the carryover option for the same FSA plan. The use it or lose it rule specifically applies to healthcare FSAs, which can cover qualified medical expenses like copays, prescriptions, dental, and vision costs. On the other hand, dependent care FSAs have different rules. They cannot offer the carryover option but may still provide a grace period. If an employee leaves their job, any unused FSA funds are typically forfeited unless they incurred expenses before leaving or choose to elect COBRA continuation coverage. However, it is important to remember that COBRA premiums cannot be paid with FSA funds. In summary, the use it or lose it rule encourages careful planning of healthcare spending within the plan year. Employers can provide some flexibility through grace periods or limited carryovers, but any unused amounts beyond these options will be lost. Understanding this rule is essential for managing your health insurance benefits and budgeting for out-of-pocket medical expenses effectively.